Hi, my name's Ruby Ford. The course code is ACM Vet 403. Perform clinical pathology procedures, and the date's the 23rd of the 3rd, 16. I'll be taking some blood via Panda's cephalic vein today. She is a 12-year-old blue heeler. 12, yeah. I'll be using, I'm doing that to get the packed cell volume and total protein. The equipment I need today is a 1 ml syringe, a 25 gauge needle. I'm using a small needle and syringe because I don't need a lot of blood. I need a very small amount, and this will be the least invasive and painful for Panda today. I also need the microhematocrits and the Critocele to plug it. I've got my scrub to clean her, so I'm going to shave her first, clean her arm with the scrub. I've got a Chlorhex soapy, Metho, and then Chlorhex aqueous. I've also got a little bandage for afterwards, just some vet wrap and a clean swab, and that's to stop her from bleeding and prevent any hematomas or bruising or anything. And I have my shaver, and I also have my refractometer, and I'll show you later the centrifuge. So first we'll shave her. Panda's going to be a good girl, and Lucy is going to help me hold Panda and hold her vein up for me. I'll just get rid of that hair over to there. I'll throw that in the bin later. So we'll start with the soapy scrub, and then the Metho, and then the aqueous. So I'll get my syringe and needle ready. It's okay, Pandy. And 1, 2, 3, Panda. Don't feel anything. Good girl. There we go. And I'm just going to put this to the side for a moment and put the bandage on straight away. And then I will get rid of my sharp. I can't do everything at once. Okay. So just remove the sharp and pop it into the sharp bin. And then grab my microhematocrit tube. With the red end up, I just stick it straight into the syringe if I can, and the blood will just come down into it. All good. I just plug one in with my finger so the blood doesn't come back out, and then I poke it into the clay. I have to put lots of clay in it because we have a really large centrifuge, and if you don't put lots in, the clay will come out and you'll lose all your blood. So I think that should be enough. So now we're going to go pop it into the centrifuge. So I just pop it in there, across from the other one, which balances it out so that it doesn't get out of balance. And I just close it, and turn it on. I'm not going to now. I have one prepared earlier because it does take a long time and it's really noisy. So we'll take it back out. So now to read the microhematocrit tube, I have my little reader, and I'll show you close up. I'm going to put the bottom of the red cells. So this is all your red cells here. You do have a little buffy coat in between that you can't really see, and then it's just your serum. So I put the bottom of that on the bottom line, and then the top of the serum to line up with another line that's close, and then in between you're going to read the middle, so where the buffy coat would be. So I've got about 40 47. It's very difficult to read sometimes. Yeah, I've got about 47, 48, which is in your normal ranges for your PCV. For dogs, it's about 36 to 55, depending on where you go, who you talk to. Now I'm just going to grab another needle, just the orange one, to get the serum out. It's probably not best practice, but I am going to break the tube. It just makes it easier to get the serum out because there's quite a big space between the serum and the end of the tube. So just break it easily. I've got my refractometer, and what I do is I get my needle and I put the needle into the end of the clay, and it should push out the serum. Sometimes this doesn't work very well. Yes, I've got a very, very tiny drop there, but that should be enough. So then I just close the lid on it, and I'm going to read it. Sorry, it's a little bit, I'm going to look into the light. Get out of focus. So I've got about 64, which is good as well because the normal values are 52 to 82. So Panda has really good values. So I'm just going to pop that back in there, and also that into the sharps bin. All my rubbish will go into the rubbish bin. And for the refractometer, I will clean it with some distilled water and a Kim wipe, and then dry it with a Kim wipe. Let me just see if there's anything I need to do. So then I will also pack all of this stuff up and put it away, and I will spray and wipe the table with some F10 and just a wiper, a paper towel. With the clippers, I spray them with a disinfectant spray and brush them out with the toothbrush, and I just do that over the bin. And I also do it in a really ventilated area because the spray is quite nasty to the breath. I think that's all I need to do. So that's how you do a PCV and TP.